Hey guys, so somebody came in today, a patient came in today, and she was really upset. She was diagnosed with a disc protrusion. So what that is your body, you have 24 movable vertebrae in your spine, and between each vertebrae lies a what's called an intervertebral disc. You may have heard of a degenerated disc, a slip disc, a herniated disc. You may have heard of those types of terms. So an injury to a disc involves an injury to the soft tissue between the spinal bones. So she had a disc protrusion, which means that if you envision like a jelly donut and somebody pushed the donut, it would start to bend on the side. Now, if you squish the jelly donut and the jelly came out, that would be a disc herniation. But a disc protrusion is just a swelling on the side. And she was really upset because the healthcare provider that gave her that information, she had had an MRI, and the healthcare provider that gave her that information really scared her by explaining to her that she could end up with something called cauda equina syndrome. Now, cauda equina is a very serious condition that if you have it, it can be life-threatening for sure. And what happens in cauda equina, that's the name of the end of your spinal cord, that if the disc pressure gets so hard on the spinal cord at that point, the person would lose the ability to walk, lose the ability to control their bowel or bladder, etc. And it's a serious condition. But to suggest that somebody who has a disc protrusion is on the verge of cauda equina syndrome is not really true. In fact, and this might surprise you, you can have a disc protrusion or a disc injury and not even feel it. So this study came across my desk, and it's from the European Spine Journal. And what they did was they measured 800 different people between the age of 24 and 27. So this is not an older population, 24 to 27-year-olds, 800 young adults, and they split them into two groups basically: people who have spinal pain and people who don't. And they did an MRI on them, and here's what they found. So of the people that had recurrent spinal pain, neck pain, things like that, here's what they found. 69% of those people had a disc protrusion. 56% of them had already disc degeneration. So this is like a 24, 25-year-old, 26, 27-year-old with a degenerated disc, something that we used to only think happened in older people. And a disc annular tear, which is a tearing of the annulus fibrosus, it's called. It's not important you remember that. Just a tearing internally of the disc was 50% of people. And 25% of those people had a disc herniation. Okay? So of all the people who had spinal pain, they all had some type of damage. Many of them had some type of damage to the disc. But here's the comparison. Of the people who had zero symptoms and zero pain, 87% of them had a disc protrusion. That means more people had a disc protrusion in the group that had no pain than in the group that had some pain, which was 69%. In disc degeneration, 73% of people with the no pain group had disc degeneration, and only 56% in the people with pain. It was 63% had an annular tear in the people with no pain versus 50%, and 0% of people had a disc herniation with the no pain, and the people who had a disc herniation in the pain group were 25%. So hang on. If that was confusing, follow me for a second. There were more people with no pain that had disc protrusion, disc degeneration, and a disc annular tear than in the group with the people who had pain. So what does that tell you? It tells you the same thing that I've been saying for decades. You cannot rely on how you feel as an indicator of your health. Not ever. It never, ever, ever tells you. Your body, you have to remember, symptoms are your body's way of communicating with you. The symptom is not the problem. And, the early stages of cancer, what does that feel like? Nothing. Heart disease. What does high blood pressure feel like? Nothing. What does high cholesterol feel like? Nothing. What does a subluxation in the spine? That's what a chiropractor corrects. A subluxation in the spine at the beginning feels like nothing. There are no symptoms. A cavity in your tooth, right? At the beginning, what does it feel like? It feels like nothing. The dentist finds it on an x-ray or by evaluation, and helps you understand that it's there. Now, the one thing that's consistent with all of those problems, if you leave them long enough, eventually you'll have a symptom. But relying on a symptom as an indicator of when to do something from a health perspective is just waiting too long. That's why I always say, and I can't say it enough, being proactive with your health is always a good idea. Being reactive with your health is always too late. The tissue damage has already taken place. And this is just another study to show the same. All right, guys. Hope you have a great day. I hope you find that kind of thing useful. Thank you.